Hi, Dr. Sean Woods here with the Healing Vibe. We are back today talking about the ileocecal valve. We just got done talking about leaky gut, and we're at this part now of the small intestine where the small intestine comes to an end and it meets the large intestine. It's down on this lower right quadrant, and major valve that's responsible for many problems inside of the human body. Let me show you a quick picture of it here. So here's the large intestine coming around. Here's all the small intestine. The small intestine comes in and meets the large intestine here. And that part of the large intestine is called the cecum. And at the end of the cecum is where the appendix sits. And this area becomes a problem and a congested area in almost all people that I take care of. When you're not digesting food properly, we've talked about the stomach and the liver and the gallbladder and the pancreas. When that food does not get broken down properly, it'll sit right at the base of this small intestine, and this ileocecal valve will shut until the small intestine is done finishing its job of digestion. And many times it doesn't ever really finish. At the base of this small intestine, there are what's called Peyer's patches, and so there's a few hundred of these lymph nodes that sit at the base of this small intestine. And this lymph system that's kind of behind this, the mesentery that I was talking about earlier, when that gets all glued up, that causes major menstrual problems, major hormonal problems in women. In men, it causes bladder and prostate problems over time. These are some of the physiological things that happen. Musculoskeletally, when ileocecal valves are congested and blocked, there's lower back pain. There is that pulling on the mesentery that we talked about earlier where it attaches to the front of the spine. That contractions in the body trying to kind of move this food through eventually wears and pulls, and you'll see disc herniations and disc bulging as a result of this activity going on. This food sitting there, this inflammation goes right down into hips and down to lower backs, causing hip problems, causing hip degeneration, causing lower back degeneration, causing sciatica, causing knee problems, foot problems. The list goes on and on and on. You cannot have undigested food sitting in the body for too long without some sort of problem. Again, from diverticulitis to irritable bowel syndrome to SIBO to leaky gut syndrome. It's a no-win situation. So when you want to get an ileocecal valve open and working, I'm always palpating and trying to open up this ileocecal valve on people. One major thing that you see all the time is people will they'll come to my office in back pain. They'll be bent over like this, and they say that they can't stand up. And many times they'll say, well, I was just brushing my teeth. I just bent over to pick up a piece of paper on the floor, and I couldn't stand up. And this is because in most instances, this ileocecal valve has locked. There's food sitting in there. Lots of times it's meat. Sometimes it's lots of carbohydrates, but it's a lot of undigested food sitting in there. And when this locks and spasms, the psoas muscle, which lies on the front part of that spine, goes into spasm and they can't stand up. And many times they see it's a miraculous thing because I'll go and I'll massage it and I'll open it up. I'll work on their back, obviously, to unlock some of their joints in their back. But they go, how did you do that? And it's just because I was able to open up that ileocecal valve and take that pressure off of there. So valves are critically important to the body. We talked about the pyloric valve. We talked about the celiac valve. We talk about now the ileocecal valve. These valves, very important and critically connected to the heart valves. Once you see valves in the digestive system failing, you know you're going to have valves in the heart failing too, because they're intimately connected. Again, through this fascial system. And going back into embryology, you start to see these connections in there. So we're thinking about digestive enzymes here. We're thinking about our okras here. We're thinking about our herbs that keep the digestive system moving and strong. Anything that can keep food moving through you in a high rate and in a quick fashion is always going to help this ileocecal valve get healthy. Now, when you see congestion start to fill that ileocecal valve, you will get backing up in that appendix, and that's where many appendicitis come from. And although you don't need your appendix, you really should keep it because it is a source of good bacteria. So when food is coming from that small intestine into the large, into that cecum, the body squirts in kind of this probiotic into that food content and starts even further breakdown, further absorption, and further digestion of your materials. When that thing gets bombarded and backed up, you will get an infection in that appendix. So remember, keep your digestive system moving, chewing your food, getting your food properly digested, and eliminating it in a timely manner, and you'll begin to heal yourself.